This is a CJASN podcast, and I am Jenny Flythe from the University of North Carolina. I'm here with one of my co-authors to discuss our recent study entitled Symptom Prioritization Among Adults Receiving In-Center Hemodialysis. In this study, we sought to identify patient-prioritized symptoms for the development of relief therapies. We also sought to elicit patient preferences for symptom treatments among adults on in-center hemodialysis. The study was conducted as part of a project supported by the Kidney Health Initiative, a public-private partnership between the American Society of Nephrology and the Food and Drug Administration.
Hello, I am Carolyn Wilkie from Punta Gorda, Florida. I am a home hemodialysis patient and serve on the Kidney Health Initiative Patient Family Partnership Council. I also served on the work group for this project. It is well known that individuals receiving hemodialysis have a very high symptom burden. As a peer mentor, I find that symptoms, especially cramping and fatigue, come up repeatedly. Patients always want to know what, if anything, they can do to relieve these symptoms. Unfortunately, I am not sure what to tell them because the answer seems to be different for every patient. What we do know is that high symptom burdens are associated with worse quality of life. It is thus very surprising that we have as few symptom-directed therapies as we do.
Recent efforts to identify patient priorities in both research and clinical outcomes have identified relief from symptoms as a top research priority. We undertook this work to prioritize physical and mood symptoms for the development of new or improved therapies for symptom relief. We conducted a mixed method study. We first performed qualitative data collection via focus groups in Carrboro, North Carolina, Tucson, Arizona, and Seattle, Washington. We then used what we learned in focus groups to inform the development of a quantitative survey that was administered online.
Across 3 focus groups, 32 patients participated. In all 3 focus groups, participants reported the physical symptoms of insomnia, fatigue, muscle cramps, and nausea, and the mood symptoms of anxiety and depression. In prioritization efforts, participants indicated that symptom frequency, duration, unpredictability, social effect, and financial effect factored most heavily into their prioritization decisions. There were 87 respondents from 27 states to the online survey. Survey results were similar to the focus group findings. Taking the focus group and survey results together, the top prioritized physical symptoms were insomnia, fatigue, and muscle cramps. The top prioritized mood symptoms were anxiety and depression.
Participants also described interconnections between physical and mood symptoms, noting that better management of physical symptoms might lead to improvements in mood symptoms. Finally, participants reported interest in a range of symptom therapies, from exercise to support groups to medications. It is noteworthy that many participants cited frustration with large pill burdens and expressed interest in non-pharmacologic strategies for symptom relief.
While there is much work left to be done, these findings offer insight into patient prioritization of physical and mood symptoms for the development of new or improved therapies for symptom relief. We hope that our study provides guidance and direction as the nephrology community seeks to foster innovation in symptom management among individuals on hemodialysis.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.